Welcome back. Really important conversation, guys, especially if you've got the littles at home. Manning Family Children's is expanding its care for some of Louisiana's most medically fragile babies. So not only, as we've told you, do they have the new NICU that's under construction right now, but the hospital is also welcoming the state's first fellowship trained infant complex care specialist. So what is a complex care specialist? Dr. Michael Evers has joined the neonatology team, focusing on premature and medically complex infants from their most critical days in the NICU through the long-term follow-up. So welcome to the show. This is just such a great topic, such a huge need in New Orleans. Why did you decide to do this?
So I've always loved working with babies and families. I'm both a neonatologist and an infant complex care pediatrician, so I spend a lot of time with sick babies. So as an infant complex care pediatrician, I really enjoy being there for families and really focusing on their long-term growth, development, and all their care coordination needs. It's hard being a family going home and transitioning home from the NICU for the first time. They just need a little extra layer of support from us.
And Dr. Evers, we were talking in the commercial break that this is a part of the country that truly needs this specialty. Why is that, and how bad is the problem?
So Louisiana has some of the highest preterm birth rates in the entire country. So we're seeing really sick babies that keep on getting sicker and sicker. So it's really important to have this extra layer of support and act like that medical home for them whenever they do transition home, because it can be really hard trying to do all of this on your own whenever you're a parent going home.
So if you are pregnant right now and you have received some news that maybe you're at risk of preeclampsia or something like this, when does the maternal care start to make sure that maybe they don't have to meet you?
So that's right away in the NICU. As a neonatologist, we go and counsel these families and try to work on these things in the inpatient side of things. And then I see those babies that end up being high risk and have a little bit more complicated NICU courses. So we're proactively always trying to get the best outcomes for our families. And
talk about when you say complex care, you're going to be a care coordinator across the specialties that are needed, correct? Talk about how this is going to work.
Yes, so we have so many different specialties at Manning Family Children's. We have every specialty that you could ever need. So whenever we have these babies that have multiple issues in each organ system, they sometimes need to see multiple subspecialists whenever they go home. So it's important for us, whenever these families have 5, possibly 10 different specialists that are following them, to try to coordinate all this and put all those pieces together for these families and make sure nothing's falling through the cracks.
And so obviously you are here now, which is fantastic, but you also need the space to do your job. So how is construction on the new NICU going?
It's going amazingly. We're hoping to open up next year. It's going to be a new 60-bed unit that has so much more space and everything that we need. Even it's going to be so much more family friendly for these families too.
Look at this. Look at these views here. Those are the renderings, right? And hopefully, you know, a baby doesn't need this, but if they do, then you have it. What happened before this was here?
So beforehand, we have a mission at Manning Family Children's to never turn any family away that needs us. So right now we are kind of stretched to capacity, and we go on multiple different units.
Right.
So it'd be nice to have all of our babies in one place to deliver the best care that we possibly can.
And you all are hiring more specialists. Tell us what you can about that.
Correct. We're always hiring more specialists at Manning Family Children's, especially to try to do as much outreach as we possibly can. So we're hiring more specialists at Manning Family Children's, but also at some of our more remote clinics in Lafayette, Baton Rouge, the North Shore, Thibodeau. We go all over the Gulf South.
Dr. Michael Evers, thank you so much for coming on the show.
Of course, thank you.
We will continue tracking the progress over at Manning Family Children's.